Mrs. Smith. My name is Barb, and I'm here today to help you with your mouth care. So I'm going to come over and wash my hands. I'm going to put on my gloves and pull the privacy curtain, which I would make sure that she was behind the privacy curtain. And for this skill, you have your choice of using either a toothbrush or a toothette. And since a toothbrush does a more thorough job, we're going to use that. I'm going to put the cap of my tube upright. I'm going to pour a little bit of water over the toothbrush into the basin just to wet it before I put on a dab of toothpaste. Okay, Mrs. Smith, I'm going to make sure I put a towel across her chest so that we don't christen her chest with her toothpaste drainage. Keep her nice and comfortable. And I'm going to bring the emesis basin up close. And so since Mrs. Smith isn't very cooperative today, what I would do is I would have my patient or resident open their mouth, and at a 45-degree angle, I'm going to brush, and for the state test, you must now say this out loud, that I'm going to brush the inner and the outer, the chewing surfaces of the upper and lower teeth, and the tongue. So I would take my time and go ahead and do that. While I'm holding my brush, Mrs. Smith, I'm sure you'd like to rinse. Here's a sip of water for you. So she would swish and spit, and we'll try that again. Okay, let's make sure and dab off your mouth. Make sure you're all clean. Does that feel good? Okay. I'm going to take my dirty linen and put it in the hamper. Take my supplies over to the sink. I'm going to rinse my basin and my toothbrush very well. Running water. And I'm going to dry off my supplies. Removing one of my gloves so that I have a clean hand to open the drawer. And put the supplies back in. Put the rest of the linen in the hamper. Remove my other glove. Mrs. Smith, is there anything you need? Would you like a magazine? Connecting the call light, making sure she can reach it. And I would leave the brakes according to the policy of the facility. And before the skill would be complete, I would wash my hands.